Hi, I'm Xianghua. I'm associate professor from Fudan University. The paper I'm presenting today is called Getting the Healthcare We Want, the use of online as the doctor platforms in practice. So first of all, what's online as the doctor platforms or ATD platforms? Today, when we talked about ICT-mediated healthcare services, we mainly talked about it as part or extension of traditional healthcare systems. That means it's a mediation between patients and their existing healthcare providers, either in the forms of emails or dedicated web portals. However, ATD is different from these ICT-mediated healthcare services in that it provides access to unknown health professionals. And so it's mediation beyond the existing patient-provider relationship. Today, ATD platforms have been introduced into many countries in the world, but their impact so far has been still limited due to the issues of scale, because most of these platforms operate as free services funded by government agencies or non-profit organizations. So there are only a limited number of healthcare professionals to answer questions, making it challenging for them to answer these questions in a timely manner. However, in recent years in China, we observed an emergence of large-scale free market ATD platforms. And this slide shows some of the most popular ATD platforms in China. And to take Haodaifu and Pian Good Doctor as an example, it is reported that there are over thousands of doctors to answer questions from over 50 million patients per month on Haodaifu, and there are over 200,000 doctors to answer questions from over 300,000 of patients every day on Pian Good Doctor. So are really getting popular. Most of these platforms, they provide very similar functionalities, although each probably has its own unique features. So here we use VDoctor as an example to show how these platforms work. So on the left is the main page. It shows what kind of channels users can choose for online consultation. With the Express channel, users can often get their questions answered quickly with a low price and sometimes for free, but they don't get to choose which doctor to answer their questions. And with the doctor channel, users can choose from a list of doctors to choose which doctor to answer their questions with a price set by the doctor, but they sometimes have to wait for the doctor to answer their questions. And what's unique with Doctor is they also provide a bidding channel, which allows users to set a price and allow multiple doctors to bid for their questions. In the middle is a doctor's page. It shows all kinds of information of the doctor, including title, department, the affiliated hospital, response rate, the average response time, price, and so on. And many doctors also share their popular science articles online or past medical cases for their readers to read. So given the popularity of these ATD platforms in China, we decided to conduct a study to mainly to answer the following research questions. First, how ATD services are actually incorporated into people's healthcare practices, and how do people deal with the potential risks as ATD services do not involve in-person checkups. So this study was mainly conducted in China, and the healthcare system in China is very different from the healthcare systems in most Western countries. Mainly, most people still don't have their own family physicians or primary care physicians. So when they have any health or medical issues, they will just walk into a hospital and will be assigned a doctor at the registration desk. And hospitals in China are classified into a ranking system of primary, secondary, and tertiary hospitals, with tertiary hospital considered to be the best. And each category is further divided into 3 levels, A, B, C. And with tertiary A or 3A hospitals commonly considered as the best hospitals in China. And of course, most of these best hospitals are located only in big cities. And for the study, we conducted semi-structured interviews with 12 patients who have used ATD services. So it's mainly from a patient's perspective. And we used a grounded theory approach for the analysis of our data. And based on the study, our main finding was that all participants had a very clear awareness of the strengths and limits of ATD platforms. So instead of relying on ATD for healthcare directly, they used the ATD cautiously and strategically to ensure, and many times combined with offline healthcare resources to ensure more reliable and cost-effective healthcare. So next I will talk in more details how they make strategic choices online and how they strategically integrate online and offline healthcare resources. So first of all, when they go on an ATD platform, the first choice they need to make is which channel they will use for online consultation. And then from the study, we found that usually when they have very simple questions or very minor health issues, or when they're looking for quick responses, they will go for the free express channel, sometimes cheaper express channel. And just as shown in this quote, I input the question and then the platform randomly assigned a doctor to answer. Because my question was very simple, so I don't think I needed to designate a particularly famous doctor to answer it. On the other hand, if they are facing very complex issues or very complex diseases, they will prefer paid doctor channel for a more reliable answer, as shown in this case. It's not cheap for sure, but I was very anxious about this matter, so I wanted to find a good service and a reputable, experienced doctor. If the service is free, then the doctor is probably junior and inexperienced, so I didn't dare to use it. And sometimes they will use the high price of the doctor as a way to ensure high quality of answers. And once they decided to use a doctor channel, how they choose from a list of doctors. And from the study, we found it was common that we use the information, the official ranking, the local reputation of the affiliated hospital, as well as the titles, reviews, and other information as a doctor to make a choice. As illustrated in this quote, first of all, it should be a 3A. Then I check if the doctor has treated similar diseases, how much experience the doctor has, whether the overall patient reviews are good, and whether the doctor's expertise matches the health condition I'm consulting about. And interestingly, in some cases, our participants also care very much about the doctor's age, gender, and communication styles. For example, in this case, this participant had some sensitive issues to consult. So he checked their profile page, picture to see their gender and ages because he preferred to communicate with a young male doctor. In terms of online diagnosis or recommendation, we found that our participants assessed the online suggestions very cautiously. They used various strategies to cross-validate the suggestions, such as using multiple platforms or using offline medical visit and other means to compare. As shown in this quote, I used all these three platforms at the same time. Considering it's online consultation without face-to-face interactions with doctors, and it's about health issues, I believed it's necessary to compare so that I could decide on the best course of action. In another case, this participant still decided to visit a nearby community hospital after online consultation, just so that she could compare the different suggestions from online and offline. Although ATD provides a convenient means for them to get consultation, it's limited in that it cannot provide medical tests or medicine. So in a study, we found that many times our participants had to combine online and offline healthcare resources to achieve cost-effective healthcare. For example, for some regular checkups, our participants will go to a local nearby hospital to get tested, and then will send the test result over to a remote doctor from 3 hospitals to get online consultation. So this way, they can achieve a cost-effective care. As put by this participant, doctors in the community hospitals have limited expertise compared to those online doctors from 3 hospitals. But it's the local community hospital, a great place for us to get medical tests, which we cannot do on those ATD platforms. And more commonly, we found our participants will combine offline pharmacy stores and online healthcare resources to make sure that the medicine they get from offline pharmacy store are appropriate for them to take. More commonly, our participants emphasized to us that ATD was not directly used for care, but mainly used for care navigation in terms of for them to find the right hospital or the right time for a doctor visit. For example, this quote shows such a case. It is not helpful for treatment, but helpful to seek healthcare services for treatment. It is mainly to reduce the blindness, not for diagnosis or treatment. For diagnosis or treatment, you must go to the hospitals for face-to-face diagnosis. The online doctor, maybe it was in fact his assistant, told me whether they could treat it and when the doctor would be available, and etc. And sometimes they use the ATT to decide on when to see a doctor because many times they are busy and they want to know whether it's okay for them to wait or not. For example, actually in this case, there was one time my husband had a headache and consulted online for him. The doctor said, you'd better go to hospital and don't delay. So we asked for leave from work and went to the hospital the next day. So in that case, when it's urgent issues, they had to go to see the doctor right away. More interesting, we found many participants suggested that ATD was very helpful for them to learn and for self-education of medical issues, especially important before they go to see an offline doctor. And this quote explained why that was the case. After all, the offline medical visit is very short. The nice hospital in Shanghai is always so crowded. People wait for a whole day and may only have 3 to 5 minutes of consultation. So you need to have a clear goal and prepare your questions and ask quickly. Learning online gives me a direction with my questions. As shown in our study, many participants actually read popular science articles on ATD platforms before they went to see the doctors offline. And interestingly, our participants also suggested that when learning is concerned, online consultation was probably more effective than offline consultation because it seems that doctors online are usually more patient, probably because it's based on the time of their choice. As shown in this quote, in fact, the time you can communicate with a doctor online is longer than the offline. You can book more than 10 minutes with a doctor online. So what this study brought forth is then a kind of patient agency and a work by patients and their health caregivers for more reliable and cost-effective care. So as we are emphasizing more and more on self-management, more and more work need to be carried on by patients and their caregivers outside of clinic settings. So our work, this study highlighted such a work that they need to carry it out that has not been covered in previous research. And more so, the particular healthcare system this study was situated also helped to highlight a number of values of ATT. For example, if we understand the unequal distribution of healthcare resources, we understand better why people combine online and offline healthcare resources to get more reliable and cost-effective care. And if we know that most of them don't have primary care physicians or family physicians, we understand why they would use ATT to gain a better control and to reduce blindness. And if we understand that their offline clinical session is very short, we understand better why they will join ATD for online learning before they go to see a doctor offline. So with this study, we like to call for broadening the scope of inquiry into patients' work to include the whole process patients and their caregivers go through in order to gain reliable healthcare service in a cost-effective manner. We believe that's the main value these ATD platforms to provide, and this is also the main direction we can explore further to design online healthcare services. So with this, I'd like to say thank you. And if you have any more questions, feel free to contact me with this email address. Thank you.